Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Peritubular scope series. This audio podcast as part of a Spectre compass. This audio podcast as part of a Brigadier orbit, and this audio podcast as part of a Storm Lobostics production. In this audio podcast, a little bit around summarizing the themes as part of this peer-reviewed and published works from 2012. So the main aim of the works had been to provide a sort of narrative around the coping concept. Here in this work, themes had highlighted that there is a requirement or a need for professionals and researchers to be more aware of the diverse coping models or modalities, and how they each have a basis and a way of implementation. In this regard, it is important to place additional emphasis on different models or modalities. George Engels' biopsychosocial model from 1977 requires some attention, but Engels' sort of BPS model or modality recognized that the autonomic nervous system could serve as an avenue in understanding health and the onset of exacerbation of disease. In the 1980s, and early 90s, the BPS model or modality became sort of a catchphrase for advanced amalgamation for health and behavioral sciences in sort of the hunt for precautionary in disease. The BPS model had been developed based on the sort of general theory of illness and healing, and emanates sort of coping from a holistic perspective. The BPS model or modality incorporates biological, psychological, and sociological aspects of well-being into the healing process. The model or modality is instrumental in shifting the focus from sort of healthcare, from one of healthcare, from one of from one of a focus from healthcare, from and into disease to an individual's and into a individual's into an individual's as part of an individual's health. And the model or the modality mainly recognizes sort of the sort of factors such as views, relations and tensions, serious and sort of how seriously influence and how seriously they can influence recovery and convalescence from a health complaint and disease. The BPS model can be utilized or used to understand coping, and it also targets to deliver a theoretical outline appropriate for mounting a scientific attitude for an individual or patient or patients, and sort of and suffering and suffering in around illnesses. Folkman's positive emotions theory from 1997 put forward the positive emotions theory after conducting or carrying out following up an investigation in the caregiving partners of men of males with acquired immune deficiency or AIDS. The work had highlighted that in association to intensive negative sort of well-being and concerns, the men or the males and caregivers as a, sort of and and care providers did also have a sort of a positive well-being positions during the positive sort of well-being positions during the course and around illness. Less is understood about the complete variety of coping sort of methods or modalities comprising schedule and length. These are all these can all be relating or regarding to the instruction of optimistic and disparate disparate to understand undesirable emotions. Evidence proposes that fundamental personal views, principles, and aims are heavily connected in around coping modalities or coping models around coping methodologies or modalities. Another way to integrate factors to coping with an illness is using a diathesis using the diathesis stress model, which takes into consideration both predisposing characteristics of an individuals and an instigating event. The diathesis stress model postulates that the influence of an originating occurrence is conceivably more probable to add to an incapacity of chronic illness in people who construe health and complaint as telling of somber difficulties. These can be physical indices, and so they are inclined to respond with anxiety to implications of apparent health deficiency and trust the mode to avoid ongoing onset of discomfort is to completely evade undertakings that can proliferate harm. These people are vulnerable. These people are vulnerable and sort of are referred to at risk for a persistence of symptoms around and of a sort of disability. These sort of at-risk people believe again that that all activities can cause increased symptoms, or those that are anticipated to those cause injury should be avoided. In patients with long-term illnesses or illnesses such as cancer, uh, uh, cancer, and sort of cancer amongst others. Health-related quality of life, or HRQOL, is often severely affected. One of the main concerns for well-being care staff is really in what way can patients or recipients maintain or advance a sort of quality of life, or QOL. More current investigations relating to chronic illness has surrounding identifying the occurrence of long-standing disease and concentrated on refining daily living on daily living sort of results. And when exploring when understanding coping, investigators should place more emphasis on the internal components of an individual. So, for example, the endocrinology and the immune system, around the endocrinology and the immune system. At the same time, how well an individual copes in illness and through illness is an essential role in the initiation and/or aggravation of disease. In following sort of Hansen's general adaptation syndrome model and theory research from Hansen's general adaptation theory and model from 1936. Research has developed further by renowned authors linking the nervous, endocrine, and immune systems, also termed as psychoneuroimmunology, or the PNI concept. The PNI sort of entity involves studies in collaboration concerning well-being and biological processes. The well-being element relates more so to psychology. The biological elements relate to sort of neurology, and there is an endocrine sort of basis, also biological. And finally, a very sort of a clinical a sort of very clinical element, which relates to the body's defense against external infection and aberrant cell division, known as the immunology basis. So research has been research research had been sort of thriving utilizing this model or modality in understanding coping and chronic illness. That draws this audio podcast to a close. This audio podcast as part of a Peritubular scope series. This audio podcast as part of a sort of a research and education audio podcast series. This audio podcast as part of a Spectre compass, and this audio podcast as part of a Brigadier orbit, and this audio podcast as part of a Storm Robotics production.